One of the findings that we had in our initial study of using this system was that we always were able to visualize anything that took place off to the side of the traditional 70-degree view. With a 270-degree view and being able to see what was going on in the other quadrants of the abdomen, we were able to notice several improvements compared to standard laparoscopy. One of them was, of course, introduction of the trocars. Without an experienced camera operator, we always have to point the camera at the area where we're introducing the trocar. That's not necessary with 270 surgical. You're able to see, actually, if you put the camera in at the umbilicus, you can insert a trocar in the right lower quadrant or the left lower quadrant and never move the camera when it's pointed toward the head. That's just absolutely impossible with any other standard laparoscopy. The instrument can be introduced and injure an organ unintentionally because you can't see it. This is a problem with the robotic systems that we use, which when we zoom in are less than 70 degrees. We can't see the organs that are in the way. It might be the falciform ligament, it might be the liver, and we can damage these structures. We can have bleeding taking place off to the side and never see it, maybe until the end of the case, assuming we look at it at the end of the case. With 270 surgical, you can see it all the time. So what 270 surgical does by adding side viewing cameras and going from a 70-degree view with traditional laparoscopy to 270-degree view, we can now see the entry of trocars behind us, off to the sides, and seamlessly introduce instruments without injuring tissue. And we don't have to move the camera. We can look, in other words, we can hold the camera at the laparoscope looking at the head of the patient if we're doing foregut surgery, or toward the pelvis if we're doing hindgut surgery. And we could literally put that perhaps on a robotic arm or a fixed arm and have that stability. So we don't have to have this movement that's creating difficulties and frustrations for the surgeon. We found something rather astounding that we didn't expect. We were excited about seeing 270-degree view, but we did not expect that throughout the 10 complex cases, we did laparoscopic Roux-en-Y gastric bypass surgery, Nissen fundoplications, of course, routine procedures like cholecystectomies, colectomy. We found that we never, not once, 100% of the time, we kept the camera inside the body throughout the case. That's almost impossible in laparoscopic surgery. I think that the advantage of being able to see everything is so astoundingly expansive that, as one of my friends has said, it's like having a BlackBerry and then somebody handing you a brand new iPhone and seeing what it can do. It's an amazing improvement in so many areas.